I'm Dr. Michael Stampar, and I'd like to welcome you to Spago Salon, Day Spa and Medi Spa, where you can have an experience rather than just a service. Now I'm going to turn the device up to approximately 65 in treating the mid-face, which is much thicker, not directly over bone. And I start from the bottom and work along the jawline, because the whole purpose of treating the mid-face is to contract the skin and the softening in the face that is trying to gravitate to the jawline, maximize the contraction in a J shape from the nasolabial fold up to the temple, and push the malar mound up, and only use a small amount of heat for skin smoothing along the malar mound. And I'll emphasize flattening the high side of the nasolabial fold. Check the temperature, 42. This comes with experience. I pretty much know by color and by heat, sensation on the face, and by her near flinching that I'm right about the temperature that I'm trying to reach. There's 42. When I first did this procedure, we called it the say when lift and waited for the patient to respond. After several patients, you will get good at knowing when to move along. I tell the patient, don't let it get hot. If it's getting to the point where you think I'm going to hurt you or it's going to be too hot, tell me, so that you don't pull away, and that prevents any spark gap. Reassure them that it doesn't have to hurt to work, so that they don't tough it out, so to speak. So I'm icing here because I really feel that the contraction of the solid components of the skin that I've heated are ratcheting down with each treatment, with each pass. And what I see is that in a single pass, the compliance of the skin is markedly reduced, the movement in that skin. There's a three-dimensional contraction, and I see that with each subsequent pass. And I will talk about the heating controversy in the chapter, the cooling controversy in the chapter. But I truly believe that cooling the tissue forces contraction and gives a better result.